In the state of Arizona, you guys are unique because Arizona will allow you to reposition assets into the Medicaid compliant annuity for, we call it Medicaid waiver program. So for home health care, assisted living, all the way through skilled nursing. Whereas in most states, like Utah, utilizing the Medicaid compliant annuity is really that last step in care. It's the crisis planning where they need round the clock care in skilled nursing only. So you guys actually have more opportunity than other states. So I want you to keep that in mind. I know that you're familiar with the Krause Agency, but we are an attorney-led financial services firm. We really got our foundation and our start in the Medicaid planning space. Our founder, Del Krause, is an elder law attorney and found a niche in helping people preserve assets and accelerate eligibility for Medicaid benefits. So you really are in good hands when partnering with Krause. We are the industry leader for this, the nation. We do business nationwide, and we are the #1 supporter and backer of this type of planning. We're going to identify opportunities where you would be able to utilize the Medicaid compliant annuity, how you actually qualify for Medicaid, and I'll do a couple of case studies. We understand what that can do financially to a retirement portfolio. You know, the average cost for a semi-private room is just under $9,000, but on average, I'd say it's more up towards $10,000. In fact, I looked up in the state of Arizona, you're about $8,200. So you can imagine that takes a toll financially on what we would consider middle America. So these annuities are used for middle America. It's not for the mass affluent. We're looking for couples that have about $1 million or less in excess countable assets, and I'll go over what that means, or a single individual that has about 500 or less in assets. Again, not telling you anything you don't know, but what is it? Between 10 and 12,000 individuals are turning 65 every day. So this is going to be a topic that's going to be coming up more and more as our demographic continues to age and need round-the-clock care with Medicaid benefits. So I mentioned what is crisis planning? It typically is that last step in care where you need round-the-clock care in a skilled nursing facility. Arizona is an exception to that because you can utilize it in the other areas with assisted living and in-home health care. To qualify for Medicaid benefits, though, from a federal level, the requirements are going to be about the same. You need to be 65 or older, blind or disabled. You need to reside in a Medicaid approved facility. So that's an important factor too. When you're looking to qualify for Medicaid benefits, you actually do need to be in a Medicaid approved facility. So there's going to be a lot of facilities, and maybe you're working with them now, that do take private pay clients and they don't have Medicaid beds. So keep that in mind. And then you must be a U.S. citizen or a qualified non-citizen. As far as financial side of qualifying for Medicaid, they're always going to look at income. I mentioned the average cost of care is around, $8,200 to $10,000. If my monthly income exceeds that, then I'm not going to qualify for Medicaid benefits. I have the means to pay for my own care, but that's on the high end. I would say typically most people 65 plus that are in retirement years are not earning that type of income from their retirement and Social Security. On average, the average individual is bringing in around $2,500, $2,800. So you can see that there's an income shortfall, and that's how we get people to qualify for Medicaid benefits on that side. But there's also an asset requirement. For single individuals, Medicaid wants you to spend down your assets to $2,000 before qualifying for Medicaid.